Very good evening, friends. Meeting again in the session of Robert's philosophy, and we are on concluding part of the chapter, Sycosis. So this is the psychotic miasm. He has explained in detail, right from the head to toe. Every aspect he has tried to explain and compared it many times with the syphilitic or sorosyphilitic miasm. Psychotic miasm is nothing but an overgrowth. It is related with the gonorrhea, especially chronic gonorrhea with associated with constitutional symptoms in the form of pigworts, and when it enters inside affects the soft tissues, especially soft tissues of the lungs, soft tissues of the female genital tract. Then it affects the blood producing anemia. It affects the rheumatic joints producing rheumatic disorders. Then it involves the GI tract. So everywhere you're going to find it out the problems of psychotic miasm. And Dr. H.A.Robert, he tried to compare it with the tubercular miasm at many times. The last part where the most common involvement of psychotic miasm is there, that's what we have discussed, is the urinary tract. A gonococcal urethritis is the commonest manifestation, and urethritis in any form, whether it is acute or chronic, is always the product of this specific miasm. If you try to suppress this urethritis by many means, sometimes there might be a formation of urethral stricture, and again a psychotic miasm involves over there. It is also a very important remedy in prostatic enlargement. Very important manifestation of psychotic miasm is prostatic enlargement. Then Bright's disease, that is the terminology, old terminology for glomerulonephritis or nephrotic syndrome, and which comes under the action of this specific miasm. The last paragraph which we have discussed is related with the rectal complaints, and where he has mentioned over there fistulas, strictures, hemorrhoids, sinuses, pus pockets. Those are commonly a manifestation of this psychotic or psychotubercular miasm. When malignancy has to happen in that area, the all three miasms gets involved and a malignancy develops. Malignancy generally is the product of sorosyphilitic plus psychosyphilitic miasm, and that's why all three miasms are generally involved in any malignancy. So we were there on page number 234. We have finished that page. Let us start with the 235. Today we'll conclude this chapter. In this inacquired psychotic conditions represented by prostatic gland troubles, there is a combination of all three stigmata. If there is a cancer of prostate, generally all three miasms gets involved. But if it is senile degeneration of the prostate, enlargement is there, a senile enlargement of prostate, then definitely a psychotic involvement is most common. You get the remedies like Barataka, Conam maculatum, all are psychotic remedies over there. So psychotic miasm has a dominance over prostatic troubles. The most frequent location of psychotic manifestations in women is the pelvic organs. Underline this is very important, where psychosis generally presents in female. Pelvic inflammations such as inflammation of ovaries, inflammatory processes of fallopian tubes. In fact, of the inflammatory diseases of female pelvis may be traced to this stain. So it is ovaritis, it's salpingitis, then uterine problems, then fibroids of uterus, all gets involved in this case, and where you can get very clearly the psychotic manifestation. In the more chronic types, we get cystic degeneration of the ovaries. This is again one important thing. In more chronic types, we get cystic degeneration of ovary and the uterus and the fallopian tubes. Again, the infection may pass on to peritoneal cavity, and we find general peritonitis and general cellulitis. So associated with peritonitis, associated with cellulitis, these are quite common manifestation of this miasm. and because of which there is always a delayed healing. It is not very fast recovery unless you give the proper antipsychotic treatment in homeopathy. Otherwise, it always takes a long time for recovery. Appendicitis is directly traceable to the psychotic influence. Appendicitis, chronic appendicitis, is generally traceable to psychotic myasm. Ruptured, it is acute syphilitic state. To distinguish the psychotic manifestations in the abdomen, bear in mind the colicky, spasmodic, and often paroxysmal pains of psychosis. What he's saying? Colicky, paroxysmal, coming again and again after certain period, and spasmodic. It produces very typical spasm over there. All three involves a psychotic along with acrid discharges which corrode the skin. Acridity of the discharges is characteristic to the psychotic miasm, whether it is leukorrhea, acrid, menses acrid, nasal discharges acrid. So acridity and corroding the parts is the characteristic of discharges of the psychotic miasm. Another one more feature is that the stale fish or fish brine odor often of the discharges, and this is again a common general symptom. Every discharge has that typical fish brine smell. Very important. Generally, if it is malignancy, then you can very easily catch it out. And specifically CA cervix or CA uterus, and this fish brine odor is very characteristic of the discharges over there. The mottled appearance of the mucous membranes. Mucous membranes are typically looking very typical with spots, and it indicates it is turning towards malignancy. So pathologically, when you look towards the things, you can catch very easily the psychotic dominance over there. The attempt to suppress psychotic manifestations, especially discharges, is very common medical practice. This is quite common with the allopathy. There are many vaginal tablets, vaginal pessaries are there in order to stop the discharges. But suppressive measures meet with very prompt and decided renewal of the stigmatic power and energy. After such an attempt, the destructive progress of the disease becomes much more rapid and often leads rapidly to the malignancy. If such types of measures are used, it turns out to be very fast spread of the disease. So generally a benign condition and with those abnormal discharges, if it is maintained, all of a sudden, if you stop discharge, it enters and causes more degeneracy, more weakness, more prostration, and tending towards the malignancy. So psychotic manifestations, when get suppressed, it turns towards the syphilis. This is often, very often seen in disturbances of sexual organs which lead to a surgery as a way out of the difficulty. And immediately after operation, when the physician has reason to believe his patient to be on the road to recovery, there will be a sudden flaring up of the difficult and death ensues very soon. And this I have observed in a number of patients. Those patients who have operated for the hemorrhoids, who have operated for the hysterectomy, who have operated for the tumors, fibroids, and all of a sudden they develop malignancy somewhere spread over there and they dies very early. This is commonest thing which happens because of surgery, because surgery is one of the suppressive measure in such types of cases. When such a series of circumstances occur, it is unquestionably because of psychotic influence that may have been more or less unnoticed in the patient's condition. Often there is such a consequence, often there is such a sequence of events after some injury. So sometimes it happens that there is a sequence of events happens after an injury, and this goes on and turning towards such a disorders. Psychosis containing the gonorrheal poison in its chronic state has a rheumatic conditions that we may explain. Rheumatoid arthritis, ankylosing spondylitis, systemic lupus erythematosus, all autoimmune disorders to start with always have a psychotic dominance. Generally, it is inflammatory variety of rheumatism always comes under the psychotic miasm. Gouty rheumatism always comes under the psychotic miasm. There are tearing pains in the joints which are aggravated during rest. They are aggravated during cold damp weather. and ameliorated by moving or stretching. So see the modalities, very important. Opposite to psoric miasm, aggravated during rest. Psora feels better during rest. Aggravated during cold damp weather is the characteristic of this specific miasm. So that's why thuja, medorinum, natrum salt, these are remedies which comes over there. Ameliorated by moving or stretching and ameliorated during dry weather. Which are the remedies which are better during dry weather? Generally, there are many more. But aggravation during dry weather, there are very few. Aggravation during dry weather and amelioration during damp, wet weather. There are few remedies like heparsal, like Naxwamika. Then there is one more remedy which I'm not getting it now. But there are few remedies which has directly aggravation during the dry weather and amelioration during the cold damp weather. Opposite modality, uncommon modality, which you can causticum. The third remedy which was there is causticum. They all three have very typical opposite features over there. There are pains in small joints with infiltrations and deposits. Infiltration is the characteristic of psychotic miasm. So it gets deposited everywhere. So gouty concretions, rheumatic nodules, stiffness, soreness, and lameness are the characteristic of the stigma. Stiffness, hardness, the part becomes hard, stiff, and not movable. It is sore as if something has happened. And lameness is paralytic sensation because of pain over there. The troubles in the joints where there are deposits of the lime salt as arthritic deformants are psychotic. Arthritic deformants. This is very common with the psychotics. Kali carbonicum, Kali uh, arsenicosum. You are even in remedies where you get this is again a calibromatum, calibicromicum. You get very typical features, the arthritis deformans. The gouty diathesis is psychotic base and it is always there. All remedies are gouty diathesis, they are psychotic. Benzoic acid, whether it is Berberis vulgaris, whether it is natrum sulfuricum, thuja, all are psychotic. Now he turns toward the last important part is skin. The psychotic skin manifestations tends toward overgrowth or extra deposits. The nails are ribbed, ridged, and thick and heavy. So ridged is very characteristic of this psychotic miasm. In if it is paper thin, it is syphilitic. If it is destructing, it is syphilitic. Here it is ridged and they become heavy. Moles, warts, wine-colored patches, and other manifestation of unnaturally thickened skin belongs to this classification. Moles, warts, and the freckles are characteristic of this miasm. Skin eruptions of the stigma occur in circumscribed spots and there are exfoliating eczema. There is a lot of scaling. Scaling is the characteristic of this miasm, and that scaling many times not easily detachable. If it is easily detachable, psoriatic, then it is tubercular. Psoriasis is a combination of three stigmata with psychosis and psora dominating. The fish scale eruptions are also a combination of all three stigmata with dryness of psora and squamous characters of syphilis and the overgrowth of the tissue and or the thickened skin manifestations of psychosis. What is fish scale disorder? Fish scale disorder is nothing but ichthyosis, a generally hereditary condition where there is so much dryness of the skin and the skin looks like a scales over there. That is what is called as a fish scale eruptions. Herpes zoster has a psychotic base. Herpes zoster is viral infection, but it involves, there are eruptions which are papular to start with, they into the vesicular, then vesicle ruptures, then ulcer develop. So it is a mixed miasmatic trait which happens to be there in herpes zoster, but base is psychotic. Malignancies of skin are more violent and intractable in proportions as the psychotic tint is increased. So, very commonly you can get over there all three miasms presents in malignancies of the skin, but psychotic base is more strong over there. Barber's itch readily develops in psychotic patients while it rarely develops unless there is a psychotic taint. So barber stitch again very common with the psychotic persons or psychotubercular persons. This is ringworm which you used to get over there because of use of the same scalpel over there or same blade over there, and because of which infection spreads. But those patients who are psychotic, they always catches that. Rest of the people sometimes get spared in this. And to conclude this chapter, last paragraph, what he says, we have all noted the tendency to some operated patient to develop stitch abscess. This never occurs unless there is a psychotic tendency in patient. Stitch abscesses very common with the psychotic miasm. Even though wound looks clean at the time of closure, but there an abscess develops, then definitely think about this psychotic miasm in background. So we have learned regarding the psychotic manifestation. There is one more chapter which has mentioned over there, the chapter number 30, where one more postulate related with the psychotic miasm he has mentioned over there that we're going to learn in tomorrow's session. And thereafter, from Thursday onwards till Monday, there will be a holiday. There will be no lecture. Directly we'll meet on Monday. Tomorrow, yes, definitely there will be a session tomorrow. So that's all for today. Thank you and good evening.
Sir, what does stitch abscess mean?
Stitch abscess means post-surgical abscess. After surgery, the stitches which are taken over there, the abscess develops over there in that wound, is indication of psychotic miasm.
Okay, okay. Thank you, sir.
That is stitch abscess. Okay.
Thank
Thank
you,
you.
sir. Have a good evening.
Thank you.